Hi, and welcome to the ACS NSQIP webinar. I'm Jody Jackson Jr. I am your host, your presenter on behalf of Primaris Healthcare Business Solutions. I also host the Quality Talk podcast for Primaris. I'll probably reintroduce myself in a bit after everyone has checked in. I see that Greg R. was the first to join. Okay. Oh, and Megan F. is waving, says hashtag I'm with Greg, hashtag NSQIP. So we're on the ball here today. I like that. Hi, Megan. Um, Waving at me or with Greg. I see you all are in different locations. So we've got a big cyber family here, don't we? Quality reporting friends, huh? That's good. Very nice. And there's Jonathan from Nebraska. Good. We'll have coast to coast plus the Midwest covering the whole country. As soon as, now there's Boston. Okay. Everybody, we'll wait another minute or so. I'll go ahead and give you a heads up, though, that if you stay with us until the end, you'll find out how to get our free ebook. It's from the Primaris series, Registry and Focus, ACS NSQIP. So Primaris is featuring different registries throughout the first part of the year. And so this one is ACS NSQIP. And appreciate everybody joining us. Feel free to tap the button, raise your hand to ask a question, maybe offer an observation. Go ahead and do that as we're going along, though. No need to wait until the very end. So, we can have maybe more of a conversation that way. And if you have technical questions that I can answer right away, I'll connect you with one of our quality data services abstractors, somebody on the team who can get even deeper into the weeds than what we're going to present here. Okay, one more. That's Jefferson. Can I ask, is that Mr. Jefferson? Okay. Oh, that's your name, just Jefferson. Megan F. says that sounds very regal. And I'm quoting here. She says very Victorian. and Jefferson says, thanks, Megan. No one has ever accused me of being regal. Okay. LOL. Yeah. And we're all friends here. And look at the LOLs filling up the comments. Oh, we're all in a great mood. One big happy ACS NSQIP curious family. So why don't we go ahead and get started? Right off the bat, I'll introduce myself again. My name is Jody Jackson Jr., presenting this webinar for Primaris. I'm also host of Primaris's podcast, which is called Quality Talk. Primaris is all about quality improvement, healthcare quality. The blog is called Quality Today, and I produce that also on behalf of Primaris. It was just kind of natural to call the podcast Quality Talk. So we could call this Quality Webinar, but this is the ACS webinar. Just to give you a real quick introduction to Primaris specializes in data abstraction. That includes medical chart abstraction. We have experts that are certified for abstracting and reporting to numerous registries, as well as core measures, and currently CMS web interface. That's for those of you who are with an ACO and you're required to report through the Quality Payment Program, QPP, MIPS, MACRA, so many fun acronyms, aren't there? Well, today's acronym is ACA NSQIP. Let me just give you a brief kind of outline of what we're going to talk about. A reminder, though, that the American College of Surgeons National Surgical Quality Improvement Program, ACS NSQIP, It is registered. That is a copyrighted name, an acronym. So anytime you see that in your mind, just tack that little R, in the circle. So here's the outline we're following: an overview of registries, their relationship to quality improvement and to value-based care. Some of y'all might call that value-based purchasing. And we'll talk a little bit about that. We don't want to assume that everybody knows all of the ins and outs of the shift from fee for service to value-based care or pay for performance as it is. We're going to just present that in general, in broad terms. So we'll talk also about present 6 frequently asked questions for getting to know ACS NSQIP. We'll talk about where is the value to hospitals and surgeons. How does ACS NSQIP work? And that will include an introduction to the surgical risk calculator. 5 reasons ACS NSQIP is different or unique from other registries and quality reporting programs. We'll give 5 tips for success with NSQIP reporting, and also address the pain points that are common to you, to data abstractors and executives and staffs that are saddled with that duty. So we'll talk about the power of outsourcing your NSQIP work. And then we'll recap and provide some additional resources. Any questions before? Oh, sure. Hannah B. Is this adult or pediatric NSQIP? And that is a really great question. Primaris has NSQIP certified abstractors for both, for NSQIP and NSQIP pediatric or pediatric NSQIP. That is a great question. This material today in this webinar is generally focused on, it's generally applicable to both. This isn't specific to pediatric NSQIP. Any other, remember, just raise a hand. I'll do my best to follow the comments too. Yeah, Rick asks, what about the surgical risk calculator? I'm going to kind of bookmark that for when we get to the surgical risk calculator, if that's all right. So let's talk about registries and the relationship to quality improvement and value-based care. Most registries predate quality improvement, the quality payment program. There we go. Let me back up there. This is the presentation outline that I shared with you. And now we're going to talk about registries, the relationship to quality improvement and value-based care. Most registries predate QPP reporting and reimbursement models. In fact, some of them predate by 10 or 12 or more years. Registries began as a way of associations, whether it's the American College of Surgeons, as it is with NSQIP, or the American Heart Associations get with the guidelines. Several oncology registries. We can really go down a list, a pretty exhaustive list, or comprehensive list, to show that a lot of these registries came years and years before what has become the quality payment program when MACRA was passed in 2015. And the reason for that is the associations, these organizations, got together and maybe even with prompting from the Centers for Medicare and Medicaid Services, at least some of the more recent registries, CMS says to the associations, to the professional groups, you all are the experts in your field, rather than us at CMS or HHS coming up with some metrics that you should follow. Why don't you come up with some of your own standards and your own qualifications for those registries, and and then CMS and even private insurers, commercial payers now often use those registries. They'll look at those registries to see, uh, face it, who is the best risk for payment, for reimbursement. This gets into negotiating contracts and packages with insurance providers, health insurance providers. Uh, and we'll probably reiterate later that NSQIP is not a qualified clinical data registry, a QCDR. So it is not part of the CMS MIPS reporting requirement, although it does predate CMS and MIPS, because as we'll see in a little while, it has more to do initially with uh, better surgical outcomes, better post-operative recovery, fewer readmissions, those sorts of things, all which impact the bottom line, the dollar, of course. But registries are in place to provide data sets of populations of different groups getting treatment, and to track how that's working. And I don't want to talk way under, or certainly won't be able to talk way over anybody's head today. But all that research leads to evidence-based care, better outcomes, and that's best for patients, because we'll talk to the connection to patient satisfaction, quality improvement, and value-based care. Um, you've got your patients are now being asked, they're being surveyed about their patient experience, their patient satisfaction, and that goes into decisions now about that CMS has, and that even private payers have, when they look at the value of your hospital and your patient satisfaction scores, as well as your public reporting, whether it's with registries or other quality measures. A lot of that now is public, and it will reflect upon your hospital, your clinic, in a good light or maybe a not so good light. So that's why it's important. And there is definitely an intersection here with value-based care, because a lot of the registries and are either now or are on the cusp of being used by the insurance companies, by the payers, to determine reimbursement models and so on. And there's a comment from is that Ing, ING? Yeah. Oh, great idea. He says it's an intersection with value-based care. Why not also call it instead a merger with value-based care, instead of these? That's a great image too. Instead of these two streets crossing paths, you've got value-based care, um, and then you've got the NSQIP registry and all these other registries going on the same path. I like that. It's kind of like they come down the off ramp, and or the on ramp, I guess, as it is, and they go on the same path. I like that. So this is an important part of the map to value-based care. We made a special note here that quality is the work, not just another task. And I want to tell you where that came from. Twice now on the Quality Talk podcast, we have had as a host Stephanie Mercado. And Stephanie is the CEO and Executive Director of the National Association for Healthcare Quality, that's NAHQ or NAHQ. And NAHQ really pushes or encourages, insists, in fact, the benefit of focusing on quality as a business strategy. And this is a quote from Stephanie. She says, "Quality is the work. If it's just about achieving a laudable and even profitable metric, what happens is everyone is just striving to check a box, and they're sort of missing the point. Really advancing quality as a culture and as a business strategy. So when we talk about data-driven action and all the data that comes into play here, just a flood, an ocean of data, uh, maybe it gets so overwhelming sometimes that it's almost uh, easy to see just the data. It's kind of needs to be humanized. And I know that's what you as healthcare providers are constantly challenged to do. Um, Perhaps looking at that data and putting the faces and names to those. These are people, even if it's a population data that represents a population. Keeping that humanized. And I appreciate the way that our healthcare professionals are taking the lead in that and always being cognizant of that. But if all of these metrics and all these data points are simply boxes to check, you're right. Then, as Stephanie says, that's not the point. The point is having quality as a culture and as a business strategy. I think there was a piece, and maybe it was Modern Healthcare or Healthcare Finance just a couple of weeks ago, that noted that the vast majority of hospital boards uh, had had virtually or no little or no oversight or involvement in their hospital's quality departments and quality scores. And that's a sign that there's still some catching up to do, right? Making quality part of your business strategy, part of your planning, part of your expectations, right? And we're talking about that because that's a big component of value-based care, and it's a big component and a reason for these registries. Now let's get to know ACS NSQIP with 6 frequently asked questions. Are there any other questions before we move on? None? Okay. So getting to know NSQIP with 6 frequently asked questions. And maybe this is just a starting point for a conversation, but we're going to look at some of these right now. What is the ACS NSQIP? Well, I think we've already talked about that a little bit, but more specifically, ACS NSQIP is a nationally validated, risk-adjusted, outcomes-based a program to measure and improve the quality of surgical care. That's really it in a nutshell. It's obviously much more complex than that. And this is accomplished, or the goal of this then is to compare preoperative and 30-day post-op complication rates and cases among the participating hospitals, surgeons, and their healthcare teams. Let's keep the whole team in mind here as well. And they can use the data and reports to initiate quality improvement initiatives and measures to improve the quality of surgical care, reduce complications, reduce costs, those sorts of things. So it's important to ask then, what is different from, how is it different from other quality reporting programs? And this is probably one of the most distinctive features of ACS NSQIP. It was built by surgeons for surgeons. It's not a case of a committee or a work group getting together and gleaning some information from the main players, in its case, the main players being the surgeons. This is the surgeons themselves coming up with quality improvement program for themselves, for other surgeons. So we're going to actually here in a little bit look at other ways that NSQIP is different from other quality reporting programs, but that's really kind of the main focus for the brief part of that answer. Now, how do patients benefit? Well, let's look at it. If you're looking at preoperative surgical risks, and you're also focusing then on the 30-day post-op period, and employing best practices, mitigating risks before surgery. That's obviously going to be beneficial to patients, right? Shorter hospital stays, better outcomes, fewer complications, and greatest satisfaction. And those all add up to hypothetically or theoretically should add up to reduced costs. In fact, we've got this snippet from the ACS. The primary aim of NSQIP is to prevent surgery-related complications. As a result, the ACS says that 82% of NSQIP participating hospitals see improvements in post-op morbidity levels, and 2/3 showed improvement in mortality levels. So we're not only talking about healthier patients, we're talking about fewer deaths as a result of surgical post-surgical complications. Now, what is the surgical risk calculator? And I think we had a question about that a while ago. So I see the question here, and I'm going to answer it here in just a moment. This was from Rick. He asks, is the surgical risk calculator available without participating in this registry? So let's talk about what the registry or what the SRC is. It's a great tool for many of the surgical disciplines. The calculator can estimate the probability of outcomes of a complication pre-operation or the likelihood the patient will have a certain type of complication based on risk factors. In short, surgeons can identify patients at high risk of complications and plan interventions to mitigate the risk ahead of time. Is this available without participating in the registry? And I'm afraid the answer is no. This is a proprietary tool for ACS NSQIP, the surgical risk calculator. And it is recognized as an accurate, great tool for estimating patients' surgical risk. And the SRC is constantly being expanded, refined, tweaked, and evaluated. And I think we'll have even a little bit more discussion about that here in a little while. And that's really a very brief, very cursory explanation of the calculator. It's obviously much more complex than that. And if you've got additional questions, at the end, I'm going to let everybody know how they can get in touch with us, how we will respond to you with any other questions that you have, especially those that involve more detail and more technical expertise. So how does ACS NSQIP fit in with your hospital's quality improvement initiatives? You're already doing a lot of things focused on quality improvement, focused on better patient satisfaction, fewer readmissions. That's a big one because, CMS will ding you, and the private payers as well. If you have, readmissions that within that 30-day period, patients released from the hospital, they're discharged, and they go home, and, maybe they haven't picked up the meds that they're supposed to take. There are calls that you make to remind them to do so. So much that you can do, but so much you can't do because patients will be patients, and they may not always follow a doctor's or the nurse's orders. But that being that, as I said, readmission is really just an overall, a very broad focus of all these registries. Core measures, quality improvement, and you're already working on some of those things within your hospital, perhaps already reporting to other registries, reporting other data, maybe already accumulating or abstracting some of this data. So, you've got checklists, bundles, process measures, and so on. Now, ACS NSQIP focuses on outcomes, and this will allow your hospital to identify areas for improvement and measure how well your current surgical quality improvement is going. And we've got this bit from the blog series that we did on ACS NSQIP. As with all other value-based care quality measure and reporting programs, the fulcrum is the data. With that in mind, it's absolutely vital that data is accurate, reliable, timely, and actionable. You have a good grasp of your health data, of the life cycle. Do you know where to locate it, how to capture it, and eventually use it? So all of your other quality improvement initiatives, I think we're making about 100% guess that it's all dependent on data, or it's very data heavy. So ACS NSQIP fits into that very nicely, and it really dovetails very well with other quality improvement initiatives. And this one is solely focused on surgical outcomes and the preoperative risks. So this is going to enhance so many other quality improvement initiatives. Now, where can you turn to for help? Are you drowning in data and quality reporting? So if you still have questions, or you're drowning in your electronic health record, your EHR, and chart abstraction, get in touch with Primaris. You can email us at engage@primaris.org to talk about how outsourcing your NSQIP and other quality data chart abstraction work, how that can benefit your hospital and your patients. In fact, one of our common catchphrases at Primaris is that Primaris takes care of your data, so you can take care of what matters most to you, your patients. So Primaris can take care of data, let you take care of your patients. Now, where is the value to hospitals and surgeons? We've already talked about patients who are in the hospital less time, fewer bed days, fewer nights. They're going to be healthier patients, and if they don't have to get readmitted, then you have achieved quality care, and that's incredibly valuable. But what are some of the more tangible values? Well, you can track the value of your care and of your surgical staff with the ACS NSQIP registry. The registry will help surgeons, hospitals, patients, and surgical teams by tracking quality measures. You can even track by surgeon, not just per hospital, but can track the metrics by surgeon. This can lead to improved surgical outcomes when you know which populations are maybe at greatest risk for complications, and mitigating those beforehand. And these concepts obviously aren't new to surgeons. Taking into account a patient's condition, chronic condition, comorbidities, that's been done, for ages now. ACS NSQIP provides it in a database and provides reports back to the hospital that can really aid the decision-making process from pre-surgery to post-operative care. Reducing complications and subsequently length of stay, that's a huge value to hospitals and surgeons. Establishing best practice guidelines, and benchmarking where your hospital and your surgical team stands compared to other hospitals. And keep in mind, this is risk adjusted, so it is a much fairer, more level playing field. The way that ACS NSQIP, crunches the data and issues its reports. And improving patient satisfaction. That's of great value to hospitals and to surgeons. I've already used the phrase a while ago, is your data accurate, reliable, timely, and actionable? At Primaris, we call that ARTA, accurate, reliable, timely, and actionable. And does that describe your data? We'll actually get into that a little bit more later on. Well, we have got a comment from Veronica. Veronica, okay. You want to clarify your experience with this. The focus isn't just post-op, but mitigating the risk prior to surgery. Yes, that's a big function of the surgical risk calculator. Yeah, and she's agreeing that that's what has been said. She wants to reiterate the importance of that. Can identify which patient is hypertensive, what comorbidities they have, maybe diabetes, those sorts of things. Also takes into account age, sex, demographics, all the things that can influence surgical risk. Yes, Veronica, thank you for that clarification. It's also good to see those comments here among our participants. Some of you are going to email each other and keep in touch later. See, we're making friends today. I almost said y'all. That would have been a dead giveaway that I'm from Missouri. I've got familial roots in the deep South. And Penny P from Alabama says, hi, yes, y'all is mandatory for us. And, well, bless your heart. And look at the LOLs popping up again. Oh, I'm loving this. Oh, this is good. Okay. Another factor to think about for value to your hospital. You know, there's not only the need to reduce post-op mortality and complication rates, but also, disparities of care, cost of care, in your hospital's community reputation. Those are all factors that ACS NSQIP can improve because of the depth of the reporting and of the quality improvements that can be put in place or enhanced or verified for your hospital. Because public reporting with greater transparency is good for your hospital, especially when it's due to improved patient outcomes. Because more and more patients are kind of shopping around for their care. And I know that some healthcare professionals sort of cringe at the word of calling patients consumers, but that is a reality, isn't it? Yeah, I see some comments here. There's Penny P comes back and says, yeah, unfortunately, if they're consumers, it's not retail, but it's still of value. So ACS NSQIP does directly reflect post-op surgical metrics, improve patients' lives, as well as patients are the bottom line. And I've already mentioned the report that the hospitals that had improvements in post-op morbidity and mortality levels. In fact, let's look at another figure. ACS asserts that if every U.S. hospital used the NSQIP registry, more than 100,000 lives would be saved annually, and more than $25 billion in reduced healthcare costs could be realized each year. And the information that I'm sharing with you here, and especially the parts that I'm quoting from, will all be made available to you at the end of this webinar. Question here, Mike from Boston, asking if Primaris is a tech or software company. I'm going to bookmark that and address that when we talk a little bit more about the 7 stages of the health data lifecycle. Okay, that's all right. So let's just recap. Where's the value to hospitals and surgeons? There's a connection to the triple aim: better care, better outcomes, better cost. You can track the value to patients, track measures by surgeon. It's data-driven action, right? In these Thomas from Georgia, he is saying that yes, these aren't new concepts to us, but thanks for the reminder. So ACS NSQIP, how does it work? We're going to let ACS describe the process, okay? And we're going to reiterate ARDA here in a moment, and maybe introduce that health data life cycle. So I mentioned a while ago, if every hospital did ACS NSQIP, what the results would be. What we do know, according to ACS data and reporting, is that the program does prevent an average of 250 to 500 surgical complications per year per hospital. And that equates to saving 12 to 36 lives, and obviously could reduce costs by millions. But the data, that's what's a primary characteristic that separates NSQIP from other quality reporting measures and requirements. Because NSQIP uses data from the electronic health record, but also patient records from medical charts. This does not require on billing or claims data. So this isn't, this is data that comes from within, directly from the patient record. And the fact that a great deal of it needs to still be gleaned or abstracted from the charts, the medical charts, is another big reason why it's very helpful to get an outside partner to help with this. Because if your hospital staff is also having to do data abstraction, then it perhaps is keeping them from fully implementing other quality improvement programs that you already have in place or that might be coming. So here's how ACS describes the process. A trained surgical clinical reviewer collects ACS NSQIP data. It's preoperative through 30-day postoperative data. That's collected on randomly assigned patients, entered online in a HIPAA-compliant, secure, web-based platform that can be accessed 24 hours a day. Built-in software checks and provides guidance. Technical and clinical support staff from ACS provides ongoing assistance for hospitals. So that's sort of the nuts and bolts. It's a nutshell explanation. It's certainly not. I've oversimplified it there. ACS also provides surgical clinical review training for participating hospitals, ongoing education opportunities, and auditing to ensure data reliability. Hospitals that want to partner with outside experts who are already SCR certified, they can find help. And yes, Primaris provides NSQIP medical chart abstraction, data collection, and reporting. So SCRs do receive extensive initial training prior to starting data collection, and then ongoing training and continuing education through modules, conference calls, and so on. There are a lot of checks and security features built into the software, and the support tools are there as well. The auditing is really important because some of the reports in the NSQIP ACS will provide to the hospital. It will flag where internal diagnostics are audited. So I'll make sure that your technology is secure and is working well, and that your surgical teams are working well, and that your patients are getting healthy and recovering from surgery. So there's a deeper dive for a lot of the nuts and bolts here of how it works, but this is the overview. There is a daily and there are summary reports that NSQIP provides And that's the summary reports typically are a little bit deeper data. The daily reports will help guide ongoing decisions. So this isn't just a case of, hey, we're going to have all this data and then we're going to be able to help the next patient who comes along, or we're going to be able to help, the data from quarter one, what's going to help really with Q3 or Q4. And that's true. But this data comes really live time, real time. And, so it can help better the care and understanding of complications that do occur. It can help right now doing that. And we've put here in quotes, preventing the preventable. If there's one way to sum up the reason and the mission for ACS NSQIP, it's preventing the preventable. And that in the long run is in the short run, best for surgeons, best for hospitals, best for patients. So 5 reasons why NSQIP, ACS NSQIP is unique or different. We should reiterate here why registries are now more important than ever. They've existed prior to the quality payment program, prior to the official start of value-based care, where physicians, surgeon clinics, hospitals, they're not reimbursed now based upon the volume of the care, the number of patients, but on the quality of that care. And registries are spot on for helping determine all of that. It's built by surgeons for surgeons. We've mentioned that. Data and analysis is designed to improve real-time decision making. We just talked about that. And it's different because of where the data comes from and how it's collected. Remember, it comes right from the EHR, the medical charts. It's not from claims data or billing data. We'll have to ask again, is your data ARDA? Is it accurate, reliable, timely, and actionable? We're going to provide you some more information on data that is ARDA and how to give your own data a checkup. Now, here's where the question from Mike from Boston comes in. Mike asks, is Primaris a tech or software company? And the answer is no. But you'll notice when you see our 7 stages of the health data life cycle, because we talk about locating the data, collecting the data, abstracting the data, assimilating or putting the data together, then reporting the data, analyzing the data, and using it. It's actionable. Does your data point, that one of a billion points of data that flows through the hospital every day? That's how important that point is, because it is connected to all these other data points, needs to lead to action. And that's what our ARDA and our 7 stages of the health data life cycle really emphasize. But you'll notice that in those 7 stages that we don't include security or maintenance, because those are obvious parts of the health data life cycle. And so the ones we're focusing on today, we just consider those are part of it by default. No, Primaris isn't a technology or software company, though Primaris does have a proprietary tool, DART. That's the Data Abstraction Reporting Tool. Now, I won't do it justice to explain the DART tool, but message me here and I'll be sure to connect you with an expert. And Mike has already made sure I've got his email again. So awesome. We'll make sure to get that information to you, to connect you with an expert who can explain DART, our Data Abstraction Reporting Tool. So other reasons that ACS NSQIP is different or unique, it helps put analysis into action. It's not just a database of data. And then there's the surgical risk calculator that identifies patients at high risk of complications. Let's move on to NSQIP in a nutshell. 5 tips for success. Are there any other questions? Okay, yeah, I know some of you are saying You're waiting for these 5 steps. So let's look at them. The 5 tips for success. One is understand the 7 stages of the health data lifecycle. Now, we haven't gotten into that real extensively here. I've already kind of listed what those were. We'll provide more resources for you at the end of this webinar that we will send to you. But understanding how each of those stages is related to the other and how they all should lead to actionable data should be actionable. It results in something that you can do. Maybe it's something that confirms what you're already doing or affirms what you're already doing. Data is our friend, even though data is, right now the phrase is drinking out of a fire hose. I think that's what a lot of people would describe the data that's coming into hospitals. How much more can you actually get? And each registry or each quality measure, each quality payment method, a lot of those ask for different sets of data and they have different specifications, different manuals. So yeah, it's super complicated. And Primaris knows and feels that pain because our data abstraction team, our chart abstractors, are frontline professionals. They've been nurses. They've been in the trenches of wearing multiple hats, providing patient care, providing record keeping, and trying to do chart abstraction, all sometimes at the same time. And it's so we understand. Some have said it's okay. There's Kelly Cage just said it's maddening. Okay, boy, one after another. It's crazy. It's insane. Okay. Hey, would you make sure my boss sees this? Okay, that was Hillary. And Hillary says, no, really, please make sure my boss sees this webinar. Well, tell you what, Hillary, you're going to be able to show her this yourself because you're going to get a copy of these slides. And, be sure to give us the name of your boss and or your supervisor, and we'll make sure to get this sent to her as well. So let's look at other tips for success. The second one is learn and teach. This we offer at the risk of sounding like we're talking down to medical professionals, because obviously as a medical professional, healthcare professional, you are learning every day. That's a given. We don't want to take it for granted. We don't want to understate it. You're learning. But what NSQIP also is going to do is going to give you valuable feedback in that you can teach others. Let's say that when you look at the benchmarks for your hospital compared to the hospital across town or in the 3 cities away, and you're like, boy, they really get it right in all these areas. Well, it's also very likely just as likely that you're getting it right in a lot of different areas, a lot of different metrics. And those other hospitals can learn something from you. Incoming staff members can learn something from you. You can use this data to show prospective surgeons that you're trying to recruit. Hey, this is what we do really well at this hospital, and this is how we found out. This is what we've learned, and this is what we're going to continue to teach. Act on the data. This also just cannot be overstated. Just can't emphasize this enough. Act on the data, and NSQIP, ACS NSQIP certainly puts you in a position to act on the data. The data doesn't just say static. Nurture or develop a culture of quality improvement, patient safety, and patient satisfaction. It goes back to what Stephanie Mercado at NACU says. Quality is the business. It's not just a check mark. And when we see quality as an integral part of our business and of all of the processes, that's a great tip for success. And then number 5, seek and use expert outside help. Well, that takes us to the pain points. The power of outsourcing NSQIP and abstraction and reporting, and looking at other. Okay, here's a question that we'll get to. I think I already mentioned this. Does NSQIP qualify for MIPS reporting? Okay, this was Ing. He didn't recall the answer. And no, NSQIP is not a qualified clinical data registry, a QCDR. It is not on the CMS HHS list that's required for MIPS reporting. But don't let that diminish the importance of this because you understand that NSQIP wasn't put in place as a reimbursement tool to begin with. That wasn't its point. The main point was to find out how to avoid, to prevent the preventable using the power of data and the power of the teams collaborating with each other. So that was a great answer, a good question, and I hope that was a sufficient answer. Let's look at the power of outsourcing NSQIP abstraction and reporting. At Primaris, we have an ebook called the 5 Ps of partnership. And when you're looking for an outside source, an outside partner to help with your abstraction and reporting, you really, we encourage you to look at 5 things. And they all start with Ps. That's kind of easy to remember. Patients, people, passion, performance, and process. Keeping your patient number one. You know, we did Primaris did an emphasis 2 years ago. It was February 2018, declaring 2018 the year of the patient. And that was really a year-long theme that made several mentions of and encouragement to healthcare teams to make sure that their quality reporting team included the patient. And now that patient isn't going to be doing data abstraction and they're more concerned with feeling better and staying out of the hospital than they are with anything about the data, unless it just directly affects their health. But making sure that you remember the patient is part of that quality reporting team, because obviously the quality is all about that patient, right? So make sure that the patient isn't just on the team, but they're the most valuable player, or we could say the MVP is the most valuable patient. People is an incredibly important part of the outsourcing question, because you want people who know how to humanize patients, people who know, have felt the pain that you feel, and they understand relationships, and they understand, there's so much about business that's just, data points and dollar signs and cent signs, and everything is this digital, cyberspace just isn't a very personable place. But you can still find people who are personable and who are people who can treat you like a person with respect, even though you might not ever actually see each other or meet in your different parts of the country or different parts of the world. We've had one of our testimonials about Primaris was that working with Primaris is like working with somebody in a cubicle right next to you. And I think that was from Loma Linda. It was a hospital out in California. Look also for a partner who has passion. This isn't just a job. This isn't just something that you're doing in your spare time to say, well, let me crunch some numbers and help, find some data for you and report it to the proper authority or registry. No, there's a passion for this work, because Primaris knows that, and the abstractors know, because they're former nurses and former frontline workers. They know that this impacts patients ultimately, and so there's a passion for making the process better and making patients better. So I mentioned process. There's also performance. What does your prospective outside partner do as far as performance? What's their track record? What's their story? And we're going to also provide you with the ebook, The Primaris Story, because I've already mentioned that Primaris has been doing this sort of work for 35 years, and it's ongoing. We're also going to give you 3 tips for finding a partner. Let's look now at a recap. Now you know NSQIP. Everybody, round of applause. Okay, Clark, I've got a question coming in here. Clark from Kansas. Oh, I'm sorry, Kansas City, Mo. Hey, go Chiefs, right? Everybody say, yay, Patrick Mahomes, Super Bowl champion Chiefs. You say, can I repeat? You missed, how long has Primaris been around? Well, okay, the short answer is that Primaris really is a pioneer in quality improvement and value-based care. When the Joint Commission first, this is an example, when the Joint Commission first piloted core measures back in, I'm going to say 98 or 99, Primaris was on board, part of the first Joint Commission pilot on core measures. Before that, even as far back as the mid-80s, Primaris was a peer review organization. So Primaris has been doing data abstraction before it was called data abstraction. I mean, I don't know what it was called back then. Maybe it was called data abstraction, but that's certainly a key phrase now. And we know that people looking, hospitals, organizations looking for this sort of help, that's exactly what they're putting into Google. You know, I need help with medical chart abstraction. I need help with healthcare data abstraction. Primaris has been doing that since the early 80s. So we're looking at least 35 years now. That's how long Primaris has been doing this. That was from Clark from Kansas City, Mo, home of the Super Bowl champion Chiefs. And now Nick is telling Clark that's back before you were born. Oh, and then there's another string of LOLs. Oh, now Nick says, go 49ers. Okay. You know, you all can go quarrel later. Okay. It's all good natured fun, I guess. And Clark says, well, who won that game? Okay. I love this. Before I grew up to be a host for webinars, I was a sports writer. So lots of good memories of those days. So let's recap. Now you know NSQIP. We're going to provide additional resources for you, as well as we're going to provide you the ebook. We're going to, oh, here we go. This is another resource we'll provide. It's a blog titled The Mysterious Case of the Missing Data. One of the real pain points for hospitals when it comes to gathering data for registries is, you know, some data is missing. It's been miscoded perhaps in the EHR or EMR, or if it's still a medical chart on paper, if there's still some of those around, you know, perhaps that's missing. And it might be, especially in the case of a coding error, you know, going in and finding that. But the mysterious case of the missing data gives you some practical tips on how to keep that from happening. Oh, and here's our bonus offer, our free ebook, Focus on ACS NSQIP. And this is how to get in touch with us. We're in Columbia, Mo. Hey, feel free to come right to that site there. It's a real growing part of the South, what would we call that, Southeast Columbia, Missouri. Columbia is the 4th largest city in the state of Missouri, about 120,000 people, I guess. Home to 4 universities, colleges, and huge healthcare hub there in Columbia. There's our phone number and the email address. And I'm going to bet that both of those are easier to accomplish than, you know, getting in your car and driving to Columbia. Although you're welcome to do that. Let us know you're coming, and you know, if maybe Nick and Clark could make that trip together. That'd be an interesting road trip, wouldn't it? Okay. And Nick says he's from the West Coast, so he might be a 49ers fan. Okay. Appreciate that. Appreciate that very much. that is all we have for this webinar. As I promised, there is additional help from with technical parts of this. And when I mean technical, I'm talking about the nitty-gritty of data abstraction. You might also want to know more about our Dart tool. Go ahead and we already have your email address. So if you're still at this point of this webinar, you're going to receive all those resources that I just told you about. I don't know that the Dart tool is part of that. I'll make a note to try to make sure that that is included in case more than a couple of you want to know about that. Several of you have already given an email saying, hey, make sure I get A, B, or C. I appreciate that. You can access our Quality Today blog at www.primaris.org and go down to the bottom of that homepage and you can click on the blog and you will find this and many other blogs. And we urge you to subscribe to that blog too while you were there. Are there any other questions? I don't see any other hands. I appreciate everyone. So many of you have stayed around for this entire presentation. I hope it's been informative and it's giving you something to take back to your team. That's right. Yeah. A couple of you said, make sure my boss gets this, and we'll make sure to do that. And Penny P says, well, bless your heart for that. I appreciate that, Penny P from Alabama. So that is going to be all for now. Here's how to get in touch with us. Appreciate your participation, and you all have a great rest of your day.